These are in listen-only mode.
Good morning, everybody. This is Joanne Healy. I'm the clinical educator in Victoria. I'm going to be taking your webinar this morning. What we're going to be covering today is looking at the different types of eye treatments that we have available at AST. And I'll be covering mainly the products that we support the eyes with at home, because this is what's crucial in terms of maintaining skin health, as we know is our home care, but also with the eyes as well. I will briefly at the end just sort of quickly discuss some other treatments that you may be able to offer in your clinic as well. So what I want to cover first is just really going over common concerns and reasons why people are getting these sort of conditions. So looking at aging and the eyes and why these conditions are occurring. So probably the main ones that we see out there would be the dry and flaky, resulting in fine lines and wrinkles, and then also the puffiness and the dark circles. So I'm going to go through each individual condition and then look at the causes of why that's happening around that eye area. So basically, around the eye area and the extracellular matrix within that eye region, or that periorbital region, is quite different to the rest of your face. What you'll find, it is a lot finer and a lot more transparent. So you'll find that the dermis and that extracellular matrix is naturally it's quite a lot thinner than the rest of the face. So therefore, it's going to be quicker to see the signs of aging in that area. What that also means is that you will find the stratum corneum and the natural moisturising factor is not going to be as strong or as thick in that area either. So it's going to be a lot easier to have transepidermal water loss, so therefore, losing more moisture from the area and not having as good a structure of that natural moisturising factor to hold the moisture in. So, some of the reasons why this is happening, of course, yes, UV exposure. As we know, UV is increasing more free radical damage around the eye area and around on the skin, of course, but particularly that eye area is being, attacked more and more, and probably faster than the rest of the body and the rest of the skin. So you'll find that the UV exposure is also going to contribute to more MMP activation, and these are the matrix metalloproteases. These are the enzymes that break down the proteins in our skin. Collagenase, elastase, hyaluronidase are the key ones that we talk about all the time. These are going to be stimulated more so, with UV exposure and environmental damage, but also they're going to be at an unbalanced rate as we're aging. So there's going to be too much breakdown to what we can produce those proteins. So therefore, the dermis is starting to break down more and more, and then that results in the epidermal cells not turning over as effectively, and we're not producing that, that good natural moisturising factor or that barrier protection that our skin requires. So what that then results in, yes, is low moisture retention within the skin, and you see it more so in that eye area, seeing that crepiness, and then fine lines and wrinkles start to result as well, the more that we're, losing that moisture. And we find that not only is the skin becoming more lined, but you're seeing that the area is starting to look more dry and flaky as well. The reason why the skin starts to look more dry and flaky is because the skin is drying out, yes, losing that epidermal moisture, and the flaky build-up starts to occur at the same time. So the skin will not exfoliate as effectively when there is no moisture and there's not enough moisture in the skin. We have certain enzymes in our skin and in our epidermis and in our stratum corneum that keep those cells exfoliating, and we need a certain amount of moisture to keep the cells exfoliating. So the more the skin dries out, and we're seeing this happening quicker around the eye area, the more we're getting this build up. And so, sometimes it's just a matter of making sure that that eye area is as hydrated as possible, and you'll find that often the crepiness and the dryness will start to minimise. A couple of other things that we see happening around the eye area, of course, is the puffiness. And the puffiness is something that can be quite difficult to treat because it depends on why they're puffy. As we age, we do find that the blood supply and the lymphatic system around the eye area does become compromised, and the circulation around that area does start to minimise, and it's not happening as effectively. So therefore the removal of the waste materials from this area becoming limited, so that the eye area is holding that fluid. Because the dermis and that extracellular matrix is already thinner, it makes the area weaker at the same time. So if someone is constantly, rubbing their eyes and causing a rupture of the capillaries around that area as well, not only is that going to result in, yes, dark circles, which I'll talk about in a minute, but it's also going to release lymphatic fluids in the area as well, which can sit and hold around that area if the skin isn't detoxifying properly. The other thing that can happen as a result of over-rubbing is the migration of fat pads. This can also be a genetic disposition as well, but it also can be a result of just being too aggressive around the eye areas. So whenever anybody comes in and they're concerned about puffiness and the dark circles, one of the first things I ask is about the rubbing, because it's the first thing that they really need to stop doing to start getting some changes around there. But the migration of the fat pads is quite common. And if it is very bad, this may have to result in having surgery or blepharoplasty. That's something that we can't treat just with topical skincare. But depending on how bad it is, if it's just minimal build-up, sometimes skincare can help. But yeah, the migration of the fat pads is basically the muscle, and the fat pad that's attached to the muscle is pulling away from the bone. And this is, can be a genetic thing that's happening with aging and gravity, but it also can be a result of just being too harsh and rubbing too much around that eye area, causing things to move and migrate. What this is also going to do is not only see the puffiness, sitting lower down on that lower eyelid, which we're seeing here, but you're also going to be exposing this area here under the eyes, which is going to cause the blood vessels to be more prominent, and therefore, there can be more darkening around the eye area as well. So therefore, a result of all these things in an aging skin and too much rubbing around the area, and a lack of strength and circulation, we find that we have more fluid buildup. Yes, there's less drainage of those fluids. The capillaries become more and more fragile, and we have a loss of elasticity in that area as well. So overall, we see this, this sagging and puffiness occurring in the eye area. And then finally, we have our dark circles, which is quite a common one that we do come across, and can be, very hard to treat as well, depending on what the cause of the dark circles is. What I'm going to go through with you here is looking at why dark circles occur because of the effect of the blood flow and the circulation under the eye area. So the blood under the skin does become more visible as we're aging, and as I was saying, the dermis is becoming thinner and thinner, and so the vessels and the capillaries are becoming more prominent. So that can make people just look darker anyway. The other thing that can happen is, because that area is very fragile, the more we rub the area, it's actually causing a rupturing of those blood vessels. So when you're rupturing those vessels, because they're weakened and that extracellular matrix doesn't have the support there, we have this release of red blood cells. And these red blood cells are then wandering around in that surrounding area, in that connective tissue, and pooling. And we call it blood pooling. And this it gives almost a bruised effect. And so what's actually happening is we have the oxidizing of those blood cells, so those red blood cells, or the hemoglobin. And with the oxidizing of the hemoglobin, you find that you get these different pigments occurring. And the red blood cells, what you'll find is they liberate hemoglobin, which breaks into heme, which can then follow on to blue and yellow pigment, which we're probably all familiar with bruising. And then we can also have that brown pigment occur, which is the iron component. So, under those eye area, if they are consistently rubbing and rupturing, those vessels, you're going to have a release of those blood cells into those surrounding tissues and pooling. And if the circulation is not good, it's going to be sitting and hanging around. So what I'm going to be talking through with each of the products that we use to treat the eye areas, how we can treat these different concerns, because we have many different eye creams, and I often get asked, you know, when should I use this one for what, and so on. So I want to make it quite clear as to which, you know, eye creams are for what specific skin conditions. So in Aspect, we actually have our Eye Lift 3, and it's probably, you know, one of those eye products that maybe we put to the side a little bit too much, because it really is a fantastic, you know, beginning eye cream for maybe a younger person, or, you know, someone that is starting to see the signs of aging and they want something gentle, nothing too active, because some of you may be aware we do have other eye products that are very active and are not for someone that's brand new to using cosmeceutical type products. So this would be a great way to start anybody. So whether they're younger or they're just brand new to using eye treatments, and the eye area could be quite dry and quite crepey, and you know, the drier the skin is, the more impaired the barrier is. So if we're using active eye treatments when the skin's impaired like that, it can be very tingly, and often it can cause, you know, more sensitivity around the eye area. So this is going to be perfect for someone that is that bit more sensitive and new to using eye treatments. The other thing that I would also like to say is, you know, when you're promoting your serums and your actives like vitamin C's and B's and so on, those serums also can be used around the eye area and fabulous for helping improve the skin health. And you know, and then using a specific eye area cream or treatment to then support it. So you will find that you will get better results if you're doing that as well. The other thing that I didn't explain, just with the dark circles, some people have darkness around the eye area purely because of pigmentation, and this can be genetic as well. So if they do have the pigmentation sitting around the eye area and it's not due to the blood flow, then this is something that they need to do in terms of brightening and hydrating the skin so it's resurfacing better, so that that pigment is moving out. And then at the same time, they may be using their pigment inhibitors around the eye area as well. In Societe, we actually have our brightening serum, which is specifically suggested to use around the eye area as well. But our Pigment Punch in Aspect, our Complete Pigment in Aspect Doctor, are all satisfactory to using around the eye area as well. So if they are concerned with the darkness from pigment, get them to use their pigment inhibiting serums around the eye area as well, and then they support with their eye cream. So with our Eye Lift 3, yes, we have the gentle soothing ingredient of aloe vera. We've got the sodium hyaluronate, which is hyaluronic acid, so you're going to help really plump and hydrate the area. Sodium hyaluronate is what we call a higher molecular weight of hyaluronic acid, so that will sit and hold and just really plump within that stratum corneum, so it gives an instantaneous hydrating effect. Then we also have, so we've got these mixtures of peptides. The palmitoyl oligopeptide and tetrapeptide 7 is actually matrixyl 3000 and has been clinically trialled and shown to boost the production of the connective tissue. So this is going to help strengthen the dermis, as well as inhibit MMP production. And what you'll also find is that it acts as an anti-glycation agent. So if there is more UV exposure and stimulation of inflammatory responses in the skin, the matrixyl 3000 is fantastic for inhibiting that as well. What we also have in there is the acetyl tetrapeptide 5, and this is actually being clinically shown to increase lymphatic drainage. So it will help stimulate the detoxification and the elimination of the blood stagnating and pooling in the eye area. So this is going to be a great all-round eye treatment for someone who is new to using active eye treatments. It's not too active, it's pretty gentle, but then you're going to be helping support that area, strengthening it, as well as helping improve the lymphatic drainage and removing any puffiness and darkness. We also do have some licorice in here, which is a pigment inhibitor too, to help support that, but otherwise it's just filled with lots and lots of antioxidants to help support that eye area and protect those cell membranes. So that at a wholesale price of $59.40 and retails for $118.80. Then we have our eye lift in Aspect Doctor for those of you that work with Aspect Doctor, and this is a similar solution to our eye lift 3. So it still consists of the aloe vera and the peptides, your hyaluronic acid as well as the licorice and the mix of antioxidants there as well. So still an eye product for, someone that has more of a sensitive eye area or new to using eye creams, and that may have suffer from some darkness and some puffiness in the eye area. Then we have our OptiCrystal. So in cosmetics, cosmetics is really well known for their OptiCrystal eye cream. This is probably one of the hero treatments within cosmetics. And the OptiCrystal was also known as I Believe, and we renamed it into OptiCrystal a year or so ago. So it's still the same product. This is a super, super hydrating, protective eye treatment. It is one of the best out there that you can get. It is very different to any other eye treatment that you would normally use because it is very sticky. So you need to use the tiniest amount. I know that it has been recommended to use this product at night because it's too sticky to use during the day. I actually do find, and we get a lot of feedback, that this particular eye product, if you use it too much at night, it can actually, because it's so nourishing and it helps hold and protect that moisture, it can actually make people feel puffy the next day. So what I normally recommend is use another eye treatment that's more appropriate for the puffiness, if that's a concern. I've just got a question here. I'm just going to have a look here. One moment. What I'll do, I'm going to come back to all the questions at the very end, and we'll go through that at the end. Okay. Okay, so in terms of the OptiCrystal, it's going to help support the eye area. It's very rich, so it's just a half a grain of rice. We really warm it up, and then we just basically pat it and place it along the eye area. It sits like a second skin. What it has in there is this liquid crystal. Liquid crystal is a cholesterol, which is, as we know, a lipid, and that will sit and hold like a second skin and really holds around that cell membrane. It basically mimics our intercellular glue to help support those cells. And what I find is you feel that product on the skin throughout the day. Often there's a concern of using makeup over the top. If you're using the tiniest amount, it actually makes your makeup sit and hold really nicely. So if the person is quite crepey and a bit dry and flaky, this is your ideal eye treatment. So it may cosmetically conceal darkness, but because it does have a bit of an iridescent glow to it, but it's not going to reduce puffiness or instantly like some of our other products will. It's more about that support that it gives you. So if there are both concerns there, I often recommend use this during the day to really support the skin and protect it, and then they might need to use another eye cream at night that's going to help get that lymphatic system going. So liquid crystal supports it's like a second skin. You've got alpha-lipoic acid and copper peptides, which are fabulous ingredients that help with giving more antioxidant protection. Alpha-lipoic acid is one of the only antioxidants out there. There's minimal of these that acts as a lipid and water-soluble antioxidant, so it really provides an excellent protection. You've also got the growth factors from the coconut to help with giving antioxidant protection, as well as helping with cell renewal. And Spin Trap, for those of you that haven't worked with cosmetics before, is a fabulous antioxidant that actually helps entrap a free radical and use it for cellular respiration, so it's a very clever antioxidant. So it's all about really supporting that skin and around the eye area so that you really help with that firming and crepiness. This is ideal to support if someone is having Botox around the eye area, because often with Botox it's really only helping the sort of the outer corner of the eyes, and if they've got concerns more into the middle of the face under their eyes, this is going to really help support that that eye area as well. And then we have our eye doctor. So eye doctor is quite similar for those of you that are working with Results RX. So this is a doctor's only product. So for those of you that are working in a medical clinic, you can supply this particular product, which is an excellent step up or alternative to the OptiCrystal. It has vitamin A in it, and that's really the key difference. So you're going to be getting a lot more stimulation of cell renewal. So you've got the AGP complex. It's got 1% of the AGP complex, and then you've still got your liquid crystals, the alpha-lipoic acid, copper peptide, and so on. So if someone is pregnant or lactating, you can't use this product because of the vitamin A. And if someone was really sensitive, I'd be a little bit careful as well because of that vitamin A as well. But otherwise, this is a phenomenal product for those people that want that extra, extra bit from that vitamin A for stimulation of cell renewal as well as collagen production in the eye area. This particular product may be new to some of you. This is our Eye Excellence in PCA Skin. This product, I think, for the price point is phenomenal. It retails at $61.60. So for that person that is wanting to start using an eye treatment, this is a great start. And you've got peptide technology in here as well. It is very gentle. It's probably the most gentle we have out of all of our eye treatments. So I would even go as far as saying it's probably a little bit even more gentle than our aspect, but it's a great price point. So you do have your peptides, matrixyl in there as well for building collagen, and then what it also has in there is dipeptide 2. Now we use dipeptide 2 in our Societe eye treatment as well, and this is specifically known for its lymphatic drainage properties as well. Dipeptide 2 is going to help with reducing puffiness if there's fluid retention around the eye area. But what they've also found with dipeptide 2, because it is a chain of amino acids, is that it resembles very similar to our lipid content within our stratum corneum and our intercellular glue. So it basically feeds that stratum corneum and then that barrier and that intercellular glue so that you get a better barrier protection as well. So it's very, very hydrating. You also have some licorice in there as well to help with pigment inhibition, but overall, excellent eye treatment to start on someone that's maybe a little bit on the more sensitive side or drier side or younger and they wanted to start on something and price could be a concern. But great starting point, really, really nice. Then we have one of our hero eye creams, and TNS Eye Repair has been a real hit since we've had this eye treatment because we really had nothing that sort of came close to eye repair. We did have Tiamine, and which I haven't put this in the notes, but some of you I know do use Tiamine, which has arnica and vitamin K and things like that. But and great for, I guess, a sensitive skin. But our TNS Eye Repair would have to be probably the step up from there, and it's a lot more active. And what you have in here is the growth factors. So for those of you that work with Skin Medica, we have, and those of you that don't, we use growth factor technology, which is called TNS, or tissue nutrient solution. And as we know, growth factors are all about helping with cell renewal, building collagen production. They're natural proteins that are going to help with triggering the natural processes in the skin, because what's actually happening with aging is that we're losing growth factor responses. So our cell renewal is starting to slow down, as well as our collagen production is slowing down, and as we know, from 25 to 30 that is minimizing greatly. So growth factors come into their own with aging skin concerns as well. So you've got all those responses happening with growth factors. There would be 10% of the complex that we use in here in comparison to our essential serum and our recovery complex. What we also have in here is added peptides. So you've also got matrixyl in here, which helps with the collagen growth and the connective tissue stimulation. And then to support that, we also have, retinol palmitate, which we know is an antioxidant form of vitamin A, vitamin E's and C's, and then what we also have, which I've got listed here, is the chrysin and the N-hydroxycinnamide. So what this particular eye product is specifically fabulous for is dark circles. So somebody that has the darkness, they've got the blood pooling, they've been, they've rubbed their eyes a lot, and they've got this blood pooling under the eye area. These two ingredients actually help with eliminating the blood pigments and taking it away in the lymphatics. So we have seen unbelievable results with this particular product. So, but if you've got someone who is on the more sensitive side, we have had a couple of people that do get a little bit tingly with this. So if you're worried, start them on the other more gentle ones that we've discussed earlier. Otherwise, if you've got people that just want to get in there and really get things moving, this is really fantastic. So this retails for $134. You've also got your hyaluronic and your shea and your squalane as well, which also give nourishment and instant plumping. So really, really hydrating, but fabulous for using, for that puffiness and darkness. So often what I do with this one is I'll get them to use their OptiCrystal or eye doctor during the day, and this can be a really, really good one to use at night. Or Possibly, if you want to take it that one step further, sometimes I might even use a little bit of this in the morning if I'm feeling a bit puffy, and then wait for it to settle and then pop OptiCrystal or Eye Doctor over the top. So it's really, really brilliant for puffiness and darkness. And then our ultimate. So I'd have to say this would be our most active eye treatment that we have. So the Societe Ultimate Eye Lift we launched last year has also been a really huge hit, but at the same time it is very active. So I would never give this to someone that's brand new to using cosmeceutical products, or if there's any chance of them being sensitive or dry around the eye area. This particular product has two components. So you have the lift and fill, and the lift and fill is a ball applicator, and it's a liquid. So it's mainly consists of hyaluronic acid and peptides. So we just apply that around under the lower lid. You can bring it up onto the eyebrow and then into the middle of the furrows if you want to do that as well in between the eyebrows, because of the peptides are going to help tighten and firm around that that eye area and fill with the hyaluronic. This can actually really tingle a lot, and on some people they can confuse it with a real sting. So if the skin is sensitive in any way, they will really feel it. So we only start on this if they're someone that's a more advanced eye product user, or you know that the area is definitely not dehydrated, they have more resilient skin. So during the day they would use the lift and fill, roll around the eye area, and then they would apply the Firm and Brighten over the top. So the Firm and Brighten is a cream, and we use that over the top during the day, and then at night time we use that on its own if you're just using that that product on its own, that kit on its own. So just to give you an overview of some of the key ingredients. So with the lift and fill, you've got your hyaluronic, you've got B5, which we know is also really great for helping support the eye area, and then we have the myristoyl tetrapeptide. The myristoyl tetrapeptide is what's going to help with firming and strengthening around the eye area as well. So this can feel quite active, but it's because of these peptides acting on the skin. I have had the feedback that if you apply it to your finger first and just a little bit at a time onto the eye area, it doesn't feel as active on the skin. So if that may help for some people. And then the Firm and Brighten, we have a number of different things in here, but what you'll also notice is that we have similar ingredients here to what we have in the TNS eye repair, but it is that one step further. So we have the chrysin and the N-hydroxysacchinamide. We have the matrixyl, which is the palmitoyl, oligopeptide and tetrapeptide, and we also have this mix here, which is the dipeptide and the tetrapeptide 7 combined in here as well. So you're actually getting the most advanced eye treatment for darkness, dark circles and puffiness, but therefore it is very active. So it's a great one for people that are at that stage and are ready for treating that at a more advanced level. But it will feel quite tingly, and I still find I get tingles from it anyway, but you do get a really nice tightening effect, but phenomenal for puffiness and darkness. So that pretty much brings me to the end of the webinar. I'm just going to bring up these questions. Okay. So I've got here, why do they say not to put eye products on eyelids? It depends on the eye product. Often on the upper eyelid, you'll find that the product can travel into the eye a lot easier, depending on what it is. I often recommend, if they've got dehydration on the eyelids, use their serums. Just use their more water-based serums so they haven't got oils traveling into the eye. You can bring most of our eye products up onto the brow. Probably the best eye products I would say for the upper eyelid would probably be something like the OptiCrystal, but minimal, just patted on the skin, and maybe the more gentle products like our Aspect Eye Lift, or even the Eye Excellence in PCA would be great for that area. So all you really wanted to do on the upper eyelid is just keep it hydrated, whereas under the eye is really where we want to keep it really strengthened and minimise puffiness and darkness and so on. And then my client has pigment on her eyelids and she is a Fitzpatrick 3. What is the cause? How do we treat this? Look, it's very hard for me to say when I can't see. But look, I mean, it could be a combination of maybe she's had a lot of sun exposure, could be more genetic. maybe hormonal, depending on medication that she's been taking. There could be a number of things going on. So all I can suggest is if she does have pigment on her upper eyelid, the main thing that we can really do there is get her using pigment inhibitors. So she could maybe use something like Pigment Punch or the Complete Pigment from Aspect Doctor, something that's not too active, that's going to sort of hydrate and strengthen the area, and over time, you know, hopefully they will resurface to a degree naturally on their own, and that will help protect from more pigment from coming. But the eyelids definitely is an area that we really can't treat with peels or anything like that. Okay, so that looks like that's it. Just to finish off, we have our next webinar topic, which is scheduled for the 24th of July at 10 a.m. And this is on skin consultations and the importance of skin consultations for increasing your sales, because to really get the best results for your client, as well as giving them the best idea of what they need for their skin, a proper skin consultation is so important. So this is going to be a really great webinar topic for you guys to attend. And also, just to finish off, we have our calendar special this month, which is buy 12 kits of any one brand and receive 2 free, but this doesn't include our starter kits at this stage. All right, so that's it, everybody. Thank you so much for attending, and look forward to seeing you again at training soon. Thank you.